pharmacist. I wanted to go over your discharge medications with you today. Before we get started, could you please confirm your name and date of birth for me?
Sure, it's Oscar Sanchez. My date of birth, August 31st, 1959.
It's nice to meet you, Oscar.
Nice to meet you.
So before we get started, I just want to explain the purpose of this consultation. For each medication, I'll explain why you are taking it, how to take it, how to store it, some major side effects to look out for, and the importance of taking your medications every day. I hope that you leave today with a better understanding of your medications and why it is important to take them. Does that sound okay? Okay. So first we're going to address your high blood pressure. We decided to stop the Procardia and add two new medications, which are atenolol and hydrochlorothiazide. So for the atenolol, you'll be taking 25 milligrams, 1 tablet by mouth daily. This medication is for your high blood pressure, and if you miss a dose, take it as soon as you remember. But if it is almost time for your next dose, then just skip that one and take your regular normal dose. Don't double up on doses, so if you miss one day, don't take two the next day. And this medication may make you dizzy or drowsy, so don't drive until you know how the medication affects you. If you experience any rapid weight gain or irregular heartbeat, then contact your doctor right away. And you want to store this in a cool, dry place. What questions do you have for me about the atenolol?
Can't think of any right now.
Okay, sounds good. Okay, so the other new medication that we decided to add on for your hypertension is the hydrochlorothiazide. It's going to be 25 milligrams, 1 tablet by mouth daily. So this medication is also for your high blood pressure. Because your blood pressure is uncontrolled, we're using more than one medication to bring it to goal. This medication specifically is a diuretic, and you should take it in the morning to prevent waking up in the middle of the night because it'll make you pee more than usual, so that's why you should take it in the morning. If you miss a dose, then same as the last one, take it as soon as you remember, but don't double up on doses if it's too close to your next dose. It also may make you dizzy, so don't drive until you know how it affects you. And if you experience headache or nausea, that's common, but your skin may also become more sensitive to the sun, so you should wear sunscreen before going outside. And you're going to want to store this in a cool, dry place. Are there any questions about the hydrochlorothiazide? Could you please tell me how you will be taking this medication?
I'll be taking 1 tablet once a day.
And what time of the day?
In the morning.
In the morning. Perfect. And the third medication that you've already been taking for your hypertension is the lisinopril 40, 1 tablet by mouth daily. This medication is also for your high blood pressure, and you've already been taking it, so I'm hoping that you know how to take it, but we'll review it anyway. You're going to continue to take 1 tablet by mouth once daily, and this medication may lower your blood pressure too much, and you may feel dizzy or lightheaded when you stand up too quickly, so if that happens, then let your doctor know. And a main side effect that you may experience is dry cough. If you do experience this, then you can let your doctor know and they can change the medication. And same as with the other two, if you miss a dose, take it as soon as you remember. If it's too close to your next dose, then skip it. And before you take any potassium supplements, consult with your doctor to make sure that it's okay with taking this medication. And store it in a cool, dry place along with your other medications. Sound good?
Sounds good.
Okay, any questions about the lisinopril?
No.
Could you please tell me how you have been taking it and will be taking
So
it?
I'll be taking 1 tablet once a day.
Perfect. Okay, so those were all of your blood pressure medications. So there are 3 total. So the next thing that we will be addressing is your GERD, which was the reason that you came into the hospital because of that chest pain that you were experiencing. So the medication that we have decided to give you is called Protonix. It's going to be 40 milligrams, 1 tablet by mouth twice a day. So 1 in the morning and 1 in the evening. You should take this medication on an empty stomach, so before breakfast. And it takes about 3 to 5 days to start working. So if you are still having that reflux or that chest pain within the next 3 to 5 days, then you can take Tums in the meantime so to alleviate those symptoms. And just with your other medications, if you miss a dose, then take it as soon as you remember, but if it's too close to your next dose, then skip it. This medication may increase your risk of breaking bones if it's used for longer than a year. So we really want you to follow up with your primary care physician within the next 4 to 8 weeks so that he can assess whether you still need this medication or not. Any questions about the Protonics?
No.
No? Can you tell me how you'll be taking it?
So I'll take one tablet in the morning before breakfast.
And then another tablet in the evening before dinner preferably, because it's best to take it on an empty stomach. So that was for your GERD, and now we're going to address your hypercholesterolemia, which means your high cholesterol. So we are giving you Lipitor 40 milligrams, 1 tablet by mouth daily. This medication will lower your high cholesterol and your triglyceride levels, which will hopefully prevent you from having a heart attack or stroke or any other cardiovascular event. You should take this medication once a day around the same time every day. So if you decide to take it in the morning, then consistently taking it in the morning. If you miss a dose, then take it as soon as you remember. But if it's too close to your next dose, specifically if it's within 12 hours of your next dose, then don't take it. Be careful about drinking or eating grapefruit because that can change the way that this drug is cleared from your body. So I would recommend avoiding grapefruit juice and grapefruit, the fruit. If you have any symptoms of severe muscle pain or tenderness or weakness or dark urine, then definitely let your doctor know because that's a severe side effect. And you want to store this in a cool, dry place. So what questions do you have for me about your Lipitor?
Don't have any.
None? Okay. Can you tell me how you're going to take it?
So I'm going to be taking one tablet once a day around the same time each day.
Perfect. And if you miss a dose?
I take it as soon as I remember, unless it's within 12 hours of my next dose.
Yeah.
And I just wait until then.
Yeah. Good. Okay. And then finally, we're going to address your chronic back pain that you've been experiencing. I know that you're allergic to Motrin, so we're trying to avoid other medications from that class of drugs as well, but we do want to help you with your pain. I know that Tylenol hasn't been working for you either. So we decided to give you lidocaine patch. So it's a patch that you will apply to your back once a day for the pain. So in order to apply this, there's certain steps that you have to follow. First, wash your hands with soap and water before and after applying it, and apply the patch to clean, dry skin. If your skin is wet, the patch won't stick, and so try not to get it wet and try to make sure that your skin is dry before you put it on. Don't wear it when you're showering or when you're swimming because it'll come off. Don't use a heating pad or any other heat source over the patch, and don't wear the patch longer than 12 hours in any 24-hour period, which means that if you put it on in the morning, then take it off by nighttime, and then put your next one on the next day, okay? You want to store the patches at room temperature in a closed container and away from heat and moisture because as we talked about, the wetness will make it not adhere to your skin. And if you experience any itching or swelling of your face or hands or tingling in your mouth, then contact your doctor right away because that might be a sign of an allergic reaction. So I know I gave you a lot of information, and so I'd just like to review once again how you will be taking your medications and why it's important to take them. So I think you've understood how to take all of them, but just to make sure, how are you going to be using the lidocaine patch?
So the lidocaine patch, I'll apply one patch a day for no more than 12 hours.
Make sure to wash your hands before and after applying the patch so that you don't have any extra drug on your hands. And as I said, we want you to follow up with your doctor in the next month to see how you're doing on all these medications and if we need to make any adjustments. What questions do you have for me?
Can't think of any right now.
Perfect.